Hello, Matt.
Hello, Carlos. Thank you for having me.
Thank you for agreeing for the interview. And I would like to talk to you today about how do we go about when we see an accident in paragliding, and if we're the first person to respond to it and there's nobody else, and I gotta go there and do something about it. How would you go about it?
Sure. And I think the important thing to say is that it's a little different to normal first aid because as paragliders, often when we arrive at an accident, we're the first person there. It might be our friend, help might be far away, and also there's a risk from the environment that we need to manage. So when you do, for example, like a first aid at work course, that doesn't necessarily cover all of those things. And while the principles are still the same, we have to reprioritize a few things based on the fact that it's paragliding and the situation we find ourselves in.
So how is it the difference? Like what should we consider for the differences between the normal first aid course and paragliding related?
Sure, and I think we can dig into all of these in detail, but fundamentally, it's about establishing a really good functional team with the people who are there. It's about making sure that help is on the way, and it's about really thinking about safety. You know, in how a first aid course, you often just say, "Is it safe?" and then you kind of carry on. Whereas here, we've got to think in real detail. Could what happened to that person happen to me when I try and rescue them? Are rescuers who are going to come to help be safe? There's lots we can dig into. And then when we actually dig into the first aid itself, there's certain treatments and certain areas that we need to prioritize. In particular, the pilot's airway, the management of bleeding, because we know that when paraglider pilots are severely or fatally injured, bleeding always features really prominently. We need to think about protection from the environment. And we also need to think about some of the longer term aspects of care, like how do you manage their pain if you're there for hours? How do you keep them fed and watered? All of those kind of things.
For me, fed and water and pain was something that was like no do because he was not supposed to do that in case of when the doctors come and do their thing that we don't interfere with the process.
That's a
So
good myth to bust.
yeah,
Well, we could start with that if you like. So, one of the concerns that people always have is what if this person needs an anesthetic? Like, is it a worry if I've given them some food or is it a worry if I've given them some water? When you go to hospital to have an anesthetic in an emergency situation, they treat you as if you have a full stomach anyway. So obviously, if like help is 2 minutes away, then don't worry. But if you're going to be there for a few hours, then it's really important that you give people food and water if they want it. Don't force anything on anyone. And my guide is if they're able to talk to you normally, that means they're going to be able to swallow. So if someone's chatting to you, I'm not worried they're going to choke on the medicines. And then what you can do by giving them food and water and reassurance, that's actually a really good way to help treat pain. Because the first level of treating pain is always make somebody comfortable in their environment. So it might be that, they don't want a three-course meal, but like just giving them little bits of food, little bits of drink is a really good foundation, even before you get to painkillers.
and you still can do painkillers. It's all right to give some to the person if you're gonna be there for hours.
Yeah, absolutely. So, in terms of painkillers, we like to think about what's called like an analgesic ladder or a painkiller ladder, and you work your way up the ladder rung by rung. So, at the bottom rung, and actually the most important, is reassure the person, make sure they're warm, make sure they're dry, give them food and water, as we discussed. And actually, you think reassurance, how does that help? Actually, that goes a really long way. In scientific studies, that's almost as good as some painkillers. Just holding the person's hand, putting a hand on their arm, saying, you're going to be all right. I'm with you. Help is coming. All of those things do a lot to reduce someone's pain because part of pain is anxiety, and if you can cut that anxiety down, that really helps. In terms of the medicines, the first layer is always paracetamol, which is acetaminophen for our American cousins, and that is a safe drug in basically everybody. If someone weighs less than 50 kilos, you give them a half dose. But the normal adult dose is 1 gram, and you can give that gram every 4 hours. And people think, oh, paracetamol, I can buy that in the chemist. That's no good. Give me the opioids. Actually, paracetamol is strong and it really helps potentiate all the other medicines. So it helps the other medicines work better. So always paracetamol as a beginning. The next layer up would be a drug like ibuprofen, 400 milligrams. Now, the thing about ibuprofen is it's a good drug, but if you have asthma, then sometimes that can make that a bit worse. And if someone's bleeding, you don't want to give it to them because it can make the bleeding a little bit worse. So if someone, and by bleeding, I mean bleeding a lot, not like a little bit. So if somebody's, for example, they've broken their leg, there's not a lot of blood everywhere, I've given them the paracetamol, and I'll say to them, have you had ibuprofen before? And if they say yes, great, I'll give them some ibuprofen. If they haven't had it before, or they've had side effects from things like asthma, then don't bother. Because actually the things that matter are the making them comfortable, reassuring them, keeping them warm, keeping them fed, giving them some paracetamol, and everything else is kind of diminishing returns. Another really important thing to think about with pain control is this idea of splinting. One of the things that you get super nervous about if you've broken a bone is that it's going to move or someone's going to move it. And so by putting a splint on somebody, that can really help with the pain, but also kind of with that reassurance and that anxiety. It also lets rescuers know down the line that there's an injury there if they've got multiple injuries. So one of the things that I really like are these things called SAM splints, or flexible aluminium splints. And these things, they're moldable and they're quite cheap, they're very light. I actually take 2 in my paragliding kit. And what you can do with them is shape them to somebody's arm, for example, if they've broken their wrist, and then tape it on, and that does a lot. And the key thing to do is shape it on yourself first and then put it on them. Don't try and shape it on them because that's always really sore. And that kind of extra protection that you get, it reduces bleeding, it reduces pain, and it also really makes someone feel much less anxious about their situation.
And they're being looked after already.
Exactly so. Exactly. The reason for 2 splints is that in joints that are really mobile, like if someone breaks their ankle, it can move in so many dimensions that what you actually want is a splint going around one bit and then another going around the other. So you kind of stop it moving in 3 dimensions.
Yeah. All right. So let's talk about the team. I've been to as a first responder in paragliding accidents, and if the takeoff is a bit more busy, there's going to be a lot of people coming and trying to do, which all in good faith. What would be the ideal number of people around to start with the team?
Yeah, that's a really good point. Sometimes at these things, you either have too many people or too few. And what you can do is kind of add jobs the more people you have. If you're on your own, then the only priority you have is getting help in a serious accident. Make someone as comfortable as you can, do a few quick things, but then get help on the way, because if not, you're going to be there forever. If you've got 2 people, then one person can assess and attend to the casualty, the other go and get help. Now let's flip to the situation where you've got a lot. The most important thing is to appoint a coordinator. And in any rescue, you want to be hands-on, you want to be in there, you want to be helping, but actually to step back is so valuable. And the person who's coordinating doesn't need to be the person with the most medical experience. In many ways, it's best that the person with the most medical experience is looking after the patient, and the coordinator is like an instructor or someone who knows the area or someone who speaks the local language, those kind of things. So what I've seen happen in accidents is something happens and everyone goes, oh shit, it doesn't do anything for a second. Then everyone runs in and everyone goes, oh shit, again. And then everyone kind of piles in and tries to do stuff. And then eventually a functional team will emerge. And what you want to do is short circuit that. And the way you short circuit it, and it's kind of brave, is you step up and you say, my name's Matt, I will coordinate this situation. And suddenly everyone goes, ah, oh, my God. And you can start to establish order. And then as the coordinator, you can say, all right, Carlos, you're local, you know this area. Let me find out what's going on with the casualty, and then you go and call for help. So-and-so, you've got medical experience. I want you to go and assess the casualty, come back and tell me what's going on. and what we need in terms of rescue. For somebody else, you can say, right, we're going to need a helicopter. There's a ton of paragliders here. Your job is to make sure that the whole area is safe, that we've cleared all the paragliders away, that it's safe for the heli to come along. If you've got more people, there's other really useful jobs. Like you can say to somebody, can you write down everything that we're doing? Like what time we give medicines, what time we did an assessment, all of those things. To somebody else, we were talking about reassurance before, you can say, your job is just to sit at the head of the casualty and chat to them and reassure them. Not only is that good pain control, but it also makes sure that if you see any change in the casualty's condition, you note it really quickly. So it's about finding roles for people, partly because it's useful, partly because people want to help, and also because it reduces everybody's stress if they have a role. And being the coordinator and being able to step back and see the big picture, give people jobs, that does so much to make a rescue more efficient. Equally, if you're a follower, if someone gives you a job, there are ways to be a good follower. And a couple of those are, the first is when someone gives you a job, think, can I actually do this? Because you want to help. So someone's like, can you go and call for help? And you're like, yes. And then you're like, don't know where I am, haven't got a mobile phone, don't know anyone's name, don't speak the language. So take a little pause and think, can I do this? And if you can do it, say really clearly to the coordinator, yes, I will go and do that. Go off and do it. When you've done it, come back and close the loop of communication. Come back and say, I've called for help. The ETA is 30 minutes for the helicopter. Please can we clear the area? And then kind of sink again into the background. Because for the coordinator, it's a really high stress job thinking about, trying to keep your bandwidth and keep everybody busy and like synthesize everything that's happening. So as a follower, you go in, you're really clear in your communication, you go and do your job, you say it's done, you step back again.
I've never seen that in a first response. That's a really good structure of it.
Well, you have to train for it. That's the thing. And like in hospital, we actually go to the stage in a resuscitation if everybody has like pre-assigned jobs already. And in some centres, you'll have like an X-ray coat that will say, who you are, what your name is, what your role is, and you'll have a set area in which you stand, and the coordinator will stand back. Everybody will be in their positions, and then you work like a Formula One pit crew. But it takes a lot of practice. And you see, when you first start as a doctor, everybody just kind of paddles in because they want to help. And it's kind of easier to help because then you don't have to think. Whereas actually to step back and think is what makes this efficient.
Yeah, that's something so far really good, but I'm going to train the team for the competitions before the events. Like just this part of it is already really useful so people can so we have a better organization.
Well, that's great. And actually, one of the things there is this role of simulation. So obviously pick your moment. Like, don't wait until you're on takeoff and a stressful launch. You're like, let's simulate a catastrophic accident.
Just before the task.
Exactly. But equally, don't do it, in somebody's living room because that's unrealistic. Yeah. So, find a time when maybe it's not flyable, it's too windy or something. Go to your launch and have a little think amongst yourselves, like, when I've seen stuff go wrong here, like, what does go wrong? And you're like, okay, it's perhaps a particularly steep launch. So what happens if someone, like, fails to break their glider and rolls down the launch? And then you start to think, okay, well, that person's down there. What kind of injuries are they going to have? Well, maybe they've broken a leg. And that's your scenario. So then you start your simulation. And what you find from your simulation is that, first of all, it feels a bit awkward. And sometimes people's temptation is just to kind of giggle or be a bit unrealistic, but you kind of lead that by just getting into it. And you start to try and work together. And what you find in the simulation is so much stuff. You find that you don't have mobile signal, or you find that actually if you needed a rescue up here, it would be really hard to get them here. So actually you'd need to send them to a roadhead. And you start to like pick out all these things that you only really figure out when you try. And also it just helps you work together as a team. So even if you then attended something totally different somewhere else, you've kind of got the moves and you've got the roles and you know how it's done.
Well, practice makes perfect.
It does. And like, you know, in medicine, we get to do this every day and we still do simulation because there's still so much you can always hone and improve.
Next thing you mentioned earlier is like so we established the team, like the first thing, and then we talked about the controlling of the pain and comforting the person in need. And what else should we have a look? You know, once you arrive there, if you're not a medical doctor and you have none around, when you see a person, like what would be the moving, not moving, helmets, airways, like sort of what should be the step by step?
Sure. And I think in anything, a structure is really helpful. And what's even better is that if that structure is in common with everybody else, if everyone's operating off the same structure. And so in medicine, we use this thing we call like Dr. ABC. And D stands for danger, so checking that the scene is safe. And as we've said in paragliding, you know, this can matter. You don't want to go running down the hill after that guy in your simulation. You want to stop people back and really think, could what's happened to that person happen to me or happen to a rescuer who's coming? And really work hard about safety and being thoughtful that it's okay for you to approach. Then when you get to the casualty, the first thing you do is check for response. Now that is as simple as saying, hey Carlos, you all right? And if you say, yeah, I am, but I'm hurt, okay, well, you've already ruled out a few things that could be going on. So you check for response. If they can't talk to you, you try kind of just gently shaking them by the shoulders, just to sort of work out the level of seriousness of what's happening. You then go into this ABC structure. Now, it used to be really neat, and it used to stand for airway, breathing, circulation. But what we discovered particularly through actually the wars in Iraq and Afghanistan, like every time we have a good war, we improve our first aid treatment, is that it was taking people a while to get to see circulation, bleeding, all of that. Whereas actually, that kills people really fast. So it's now become Dr. Little c for catastrophic hemorrhage, and then ABC.
Mm.
And actually for paragliding, that's really important because in serious accidents or fatal accidents, bleeding is what kills pilots. So turn up, check for danger, check for response. Carlos, can you hear me? And then the next thing I'm going to look for is the evidence of catastrophic hemorrhage. Now, what does catastrophic hemorrhage mean? You're like, how could... I think the easiest thing to say, you know it when you see it. Like blood all over the place, you know, things spurting, bad fractures, you know, all of those things. You want to deal with that first. And if you see visible bleeding, the easiest thing to deal with it is to put pressure on it. Now, you can put pressure on it with your hands, but the problem is, once the pressure's on, you can't remove it. So, all well and good, but then that hand is out of play until the end. So, better to have a bandage. If you don't have a bandage, clothing is fine. But you find the source of bleeding, you put the bandage on, and there are bandages that are kind of tailor-made for this, which I'm sure we can make appear up there. And you put the bandage on, and it stays on. I don't know if you've ever had a nosebleed, but if you have a nosebleed, what people do is they go, has it stopped yet? Has it stopped yet? Has it stopped yet? It's the same thing with bleeding. Once pressure's on, it stays on. So that's your catastrophic hemorrhage. You're like, cool, stop that. And one of the areas to be kind of quite cautious of is around the helmet, because the scalp can bleed a lot. So if the helmet's broken, you just have a think, you know, is there any blood coming from there? Cool. So catastrophic hemorrhage has been controlled. This is good. The next thing is the airway. Now, how do we know if an airway is open? What would be your best guess?
Oh yeah, if they're not talking, not responding, you can visually check it.
Yeah, so you hit it. You're exactly right. So if somebody is talking to you normally, their airway is fine. Done. Move on to the next thing. If somebody isn't talking to you normally, you have to look and see what's happening. So if someone has a full face helmet, this is where it needs to come off if you can't really visualize what's happening with their mouth and nose. Equally, if they're face down, this is where you're going to move them because you need to see what's happening and you need to open that airway.
And in this case, it doesn't matter how broken the back might be, or you have to make sure they can breathe, so you move the person anyway.
Exactly. And, you know, when we were talking about danger before, if that person's in danger, you know, if they're half in a river or if they're on a motorway or something, you're going to pull them out of danger. People really worry, understandably, about the back and about the spine. But the thing to think about is that the spine is an organ. So it's part of the brain, really. So it needs all the stuff that your brain needs. It needs oxygen and it needs blood. So you're going to control catastrophic hemorrhage and you're going to open the airway because your spine needs that same as everything else.
And if you don't do those things, it doesn't matter anyway.
Exactly. The other thing that, you know, I've seen a few people who are conscious and they've broken their neck and they've come to me like this: I have broken my neck. Like they know something's happened. And the muscles in their neck tend to like go into spasm and they go to kind of support it. So what you're actually better off doing in somebody is let them move themselves. Like rather than you saying, stay there and I will move you, where actually you're going to end up wiggling their body and wiggling their head. If they're able to move and they're able to walk themselves off the hill like this, let them, because they're going to be more gentle with themselves than you ever can be.
I don't feel their pain.
Well, yeah, you don't feel their pain, and you know it's really hard to move somebody. It's a good thing to practice in your simulation. So if someone can move themselves, it's always quicker and it's always safer. If you do have to move someone and you're worried about their spine, be it neck or lower spine, then the thing to do is to move somebody gently, purposefully, and once. So that's going to mean thinking, okay, we're going to need to move them over there because it's going to be out of the wind. It's going to be easy for a rescuer. To keep them warm, we're going to put some jackets down and other things first, so it's all going to be comfortable. I think the best position is going to be for them like sitting up a bit. That would be great. So let's do that. Let's prepare everything. Then let's move everybody as a team. So this is where the coordinator again. So you get everybody ready, you get the person ready, and you say, okay, I'm going to say ready, steady, move. And we're going to move on the word move. Okay, everyone get ready. Ready, steady, move. And everyone moves in a coordinated way, gently to that one place, and then they stay there. So gently, purposefully, once.
And in case of air waves, like when it's the first thing you see, you know, I don't know, that needs to be done quite quick, I assume. There's a limited time for.
Exactly. And that's why we have that order. Doctor, little c, ABC. So in terms of airways, we've said if they're talking to you normally, we know it's okay. If they're not, you're going to have a look. And don't sort of stick your hand in there blindly, but if you see something obvious, like teeth or like a bit of the helmet or anything else, then you take that out. Then to open the airway, and this is again, like this is the thing that's probably best learnt on a course, but I can describe it here and there are YouTube videos. You're going to either tilt the head and lift the chin, or you're going to find the angle of the jaw, and the way you find that is you go from the earlobes and you go to the bony bit where there's a corner, like a bony corner, and you push the chin forwards, and it's quite painful. And you're either going to do head tilt, chin lift, the jaw thrust, or you're going to do both. And what people don't appreciate and what isn't taught on first aid course is that airways are dynamic. So in a like first aid course with a dummy, you're like, great, head tilt, chin lift, done. But actually with a person, what can happen is as they get more awake, the airway gets better. As they get sicker, the airway gets worse. As you put that jaw thrust on, that's a painful stimulus, so they wake up a little bit. but then when you let it go, they lose their airway again. So if you have any concerns about someone's airway, then you kind of want someone watching that the whole time, making sure the air is going smoothly in and out. And if not, doing those maneuvers, the head tilt, the chin lift, the jaw thrust. And again, head tilt, chin lift, you're like, what about their spine? Be gentle, but be purposeful because the spine needs oxygen too.
Yeah, so it's basically that if you do nothing, it will be worse.
Exactly.
And if you do something and damage something else, that there's a trade-off sort of thing.
Exactly, and that's really hard because, if you're not a trained person, then it can be quite scary doing these things to someone, and your instinct might not be to do anything. And I think the two good principles, the first is the kind of classic doctor one of like first do no harm. But the one I like the most is if you were the casualty, what would you want done for you? And if you would want somebody to try moving you out of danger or to try opening your airway, then be confident and try and do that yourself for that person. That's always the thing I have in my head is like, would I want someone to do this for me? And if the answer is yes, then give it a try.
We covered bleeding a little bit, but let's go a bit more detail because we covered like the big pressure thing.
Yeah, definitely. So that's external bleeding. But we've also got to think about internal bleeding as well. You can imagine if you have a hard paragliding accident, the force gets distributed through the body. And one of the things that rescuers talk about is this idea of mechanism of injury, which is a fancy way of saying, what do I think happened? And so if you see somebody have an accident and they land on their legs, well, the legs is what you're going to be worried about. If you see someone land, boom, hard on their butt, you're going to be thinking more about, for example, the pelvis or something like that as a source. So when it comes to bleeding, the first thing to do is to look for it. And it's obvious if it's external because it's red and spurty, but still, it's not always super obvious. Like if you have something that's bleeding a little bit and it's soaking through clothing, that you can miss that. So the thing to do is to think about your mechanism of injury, think like where might the person be bleeding, but then with that in your mind, then be really systematic. So I might start at the head of the person and look for bleeding. And if you're outside, you obviously don't want to strip someone naked because not only is there the dignity question, but they get super cold. So I like to do it in like section by section. So I might unzip and look at one side of their chest, close it, look at the other, close the zip so they stay warm, look at their back. Again, if you're moving them, then that's a really good time to check their back for everything. If not, feel down their back. And then do the same with the legs. And if any source of external bleeding, you're going to put pressure on through a bandage.
In case of having pants on, do you apply it above the pants?
Or
do you cut the pants if you can? Or what?
Difficult, but ideally you apply your bandage as close to the bleeding point as possible because then you get the most pressure. But if you think that's going to be really difficult, then above. But I would always rather have bandage in contact with bleeding because then you know it's in the right spot. Once you've
that would mean cutting the pants open.
Yeah, potentially. And there's no harm in that, but then you've also got to balance the warmth question.
So after the bandage, you can put something on top,
Yeah.
A paraglider, for example.
Exactly.
To keep them warm.
Exactly. Generally speaking, if you're worried about something, it's always good to look at it. It's the same if someone's broken their ankle. People think, oh, should I leave the boot on? Should I take it off? I take it off. I like to look at it. I like to check that, blood's still going there. They can still feel it, those things. Now, I've been obsessed in this conversation about keeping people warm. And I'll tell you why. It's because when you're thinking about internal bleeding, one of the most important things is that that person is clotting their blood as effectively as possible. And one of the things that we've learned is that if people get cold, their blood doesn't clot well. And so you think, okay, well, if I live in the Arctic, fair enough. But, if I'm in Shabba in 30 degrees, is that a thing? It's a thing. Because when people bleed, the blood is one of the ways that heat gets around the body. So they start to get cold. And so I'm always like obsessive about making sure that somebody is kept warm. And the way you do that is actually by minimizing heat loss. So you think heat is lost from conduction to the ground. Okay, let's put something underneath them. It's lost from convection. So let's make sure that we've covered the wind. It's lost by evaporation. So let's have a vapor barrier. Let's put like a jacket on or something that.
The little foil blankets.
Yeah, so the foil blankets are interesting. So the point of the foil blanket is it's there to like reflect heat. So if you've just run a marathon and you're radiating a ton of heat, the foil blanket's amazing because it reflects it back. If you're injured, you're already getting colder. So the foil blanket doesn't really do anything. But what it does do is it does act as a vapor barrier, and it is a good way to keep the wind off. So like the gold standard, because one of the things in first aid is you're like, what would be the gold standard and how do I improvise? So the gold standard we call the burrito wrap. And so that's where somebody has a layer of warmth, and that can be either like active warming, like a heat blanket, or like lots of insulation, and then a vapor barrier. And you kind of wrap someone around that, and then something underneath them to stop them conducting with the ground.
Yeah, so a nice down jacket, which we all have on takeoffs, or so.
Yeah.
We can give our jacket and then put the foily.
Yeah, exactly. So a down jacket surrounded by foil bag, perfect. Or a paraglider is fantastic.
A windbreaker as well.
Yeah.
It's perfect for that.
It's not porous. It traps oxygen.
And it has 2 layers even.
Yeah, so paraglider is pretty good. The only thing about the paraglider is actually, if you try and do it in simulation, it's kind of a pain because there's a lot of it. And it also can make it quite hard to like access the person. So I think wrapping someone in a paraglider is good once you've kind of got everything else sorted. But again, worth a try.
And if you have nothing else, that's better than nothing.
Exactly. So we've talked about controlling external bleeding, and we've talked about keeping somebody warm. The other thing that I think is particularly important in our context is this idea of binding the pelvis. So you can imagine like the pelvis is a ring, isn't it? And so what happens is that when you're, if you break your pelvis, you can't really break a ring in one place. It's really difficult. So what actually happens is you either break it in 2 places, like you kind of shear it, or you open it up. And the problem with opening it up is that it exposes a lot of bone, which bleeds inside. It creates a bigger space in which the bleeding can take place, and it's incredibly painful. So again, the gold standard here is that you apply something called a pelvic binder, which pulls it all together. The problem is that's actually quite hard to improvise, and it's really sore if you don't have like strong painkillers. So what I think is smart to do in paragliders where you're worried about the pelvis is to bring their knees together, get 2 glider straps, and put them in a figure of 8. Because by holding the knees together, you're already kind of holding the pelvis in a bit more of a stable position, and then tying their ankles together or just tying their shoelaces together. And that stops the legs flopping around. And that's quite an effective way to splint the pelvis effectively, which will help with pain relief, and it will also help reduce bleeding. Equally, our SAM splints, if you're worried about their legs, that's particularly their lower legs, then you can apply those around, you can bandage them on, and that will give them comfort, and it will also reduce bleeding as well.
Limit movement so it doesn't make it worse.
Exactly. And these things all kind of tie together. Someone might say, like, how can reassurance reduce bleeding? Well, it does, because if you reassure someone, that reduces their anxiety, that slows their heart rate, that stops, this shock and all the cortisol and all the other things going around their body. So it all ties together. Like, being a good human being does actually quite a lot for first aid, even as much as medical training. Treating someone how you'd like to be treated.
And because high heart rate means a lot more blood flowing around.
Yeah, exactly.
And that makes sense. When you're calmer, you're calmer.
When you're calmer, you're calmer. Exactly. And the thing is as a rescuer, you know, people can go to rescues and have nightmares. You know, you've seen something hard, and if you feel like you've made a difference, that's the single best way, in my personal experience. I don't know the evidence, but I think where you feel like you've made a difference, that reduces the kind of stress you have and the trauma that you have of being involved in this thing. And that act of reassurance can really make a difference. It'd be a great thing. Cool. So to summarize, the first thing you're going to do is get an effective team together, appoint a coordinator or step up as a coordinator and start assigning roles. The next thing you're going to do is your Dr. ABC. You're going to check for danger and you're going to keep everyone safe. You're going to check for response and you're going to control catastrophic hemorrhage. If you see bleeding anywhere, you're going to clamp it down. And that, once it's on, it stays on. You're then going to talk to them, check that their airway's open, and if not, open it for them and keep an eye on it. The B stands for breathing, but actually we're kind of taking care of that. You're then going to focus on their a more detailed examination for bleeding, systematically looking through for external bleeding, and you're going to keep them warm. You're going to bind their knees together to help with internal bleeding. And then you're going to think about pain control, keeping them fed, keeping them watered. And throughout all of this, you always have to think, when do I have enough information to call for help? And as soon as you have enough information to call for help, you make sure help is on the way.